Hi everyone and welcome to today's webinar. My name's Yvette Adams and I'm dialing in from the Sunshine Coast. We're with the Creative Collective who are very proud to be partnering with and marketing the Fearless Conference for the Fearless organisation, of which this person's from. Belinda Neil, one of the directors of Fearless, joining us today. Belinda's very tired, she was telling me earlier, because we've kept her pretty busy lately. She's been doing a lot of media. She's pretty in demand, and no wonder, because she's amazing at what she does, and she's got some excellent stories and excellent insights of what it's like to live with PTSD. She'll be covering off all sorts of topics today, and you'll absolutely have a chance to ask her questions. We've actually seen there's already questions, which is great engagement. We're going to answer those, I promise you. But the format for today is for Belinda to introduce herself, then go into a presentation for about 45 minutes, and thereafter we'll open it up for questions. So feel free to interact with us throughout the presentation over there on the chat panel. And or pop a question and ask a question, either place. I'll be looking and facilitating, and Belinda will answer those questions at the end of her presentation. So over to you, Belinda. Would you like to say hello first before we put your slides up?
Hi, everyone. Thank you so much for your interest in this really important topic. I'm very excited today. So I think now I have to go ahead and share, because I'm running a PowerPoint presentation and I may well disappear off the screen. But if I do, I will be returning back onto the screen after the visual presentation to answer your questions. So don't hesitate, as Yvette said, and write up your questions. This is my first webinar, so Yvette's talking me through it. So apologies if there's any issues in terms of the streaming. Okay, so I'll go ahead and share the screen.
You're right there with that, Belinda.
Okay, how's that?
That's you, and you're now minimized. I'm going to turn your video off. So switch on over to your PowerPoint, make it full screen, and away you go. Looks good to me from my end. Perfect.
Okay, so there we go. Let's talk PTSD. The lived experience perspective on early intervention and management strategies. Again, thank you all so much for your interest and taking the time to watch my very first webinar and being involved in the national conversation on post-traumatic stress disorder. Now, my name is Belinda Neil, and I'm a former New South Wales Police Inspector with 18 years service. I had an amazing career, which included undercover work, homicide investigation, and hostage negotiation. Proudly trained to counter-terrorist level. But after numerous horrific incidents, I medically retired with post-traumatic stress disorder, or PTSD. After many years of research, I wrote my memoir, Under Siege, to try and raise awareness and educate those who are affected by PTSD, including families, friends, workmates, and mental health professionals. I still continue to research evidence-based management tools and early intervention methods. Today, I'm going to talk to you from my lived experience perspective about PTSD. Please note, I am not a mental health expert. My expertise is in my own lived experience, and based on this experience and research that I've conducted over the last 10 years, I'm going to talk to you today about PTSD, the signs and symptoms, give you some management tools to help those affected by PTSD, along with some resources that may help. Now, firstly, I want to tell you I'm a very, very proud member of the board, I should say, of Fearless PTSD Australia New Zealand. We're a not-for-profit charity helping people living with the long-term consequences of post-traumatic stress disorder. We also recognise that families are affected when a loved one has PTSD. Our work complements the activities of other community-based organisations and government agencies that provide services to help people with PTSD. We are not trying to reinvent the wheel. Now, our Admiral Chris Barry, our former Chief of Defence Force and our chairman, he gave a webinar back in March. He did the first webinar. And he spoke about fearless PTSD and advised us that over 1 million Australians and about 350,000 New Zealanders suffer from PTSD. Another 4 million people in both countries live with PTSD in their daily lives.
Now, Chris also told us that there is much in the media about veterans and military people with PTSD, but they only make up 70,000 people out of the 1 million Australians affected. And yet this group gets specialist support from a dedicated government agency, the DVA, unlike everybody else. I think Admiral Barry best pinpoints the Fearless team's attitude when he says, no one should be left behind in getting treatment and support to overcome PTSD. Very briefly in his webinar, he spoke about why we need a national conversation. That experts estimate there are about 3,500 groups around Australia who are working on aspects of PTSD. Yet there is no national forum to bring people together to share their experience and knowledge. We want to see a national scheme where all sufferers and their families get help and support. Now, a conversation is the best way to build new relationships also with like-minded people and create vital networks. Our networks can be used to help each other and to organise better to get things done. And to get action from our political leaders, we need to come together and start speaking with one voice. In particular, we need to be active in representing the needs of people who have no special way of getting the help they need. So let's talk PTSD. Now, because there may be some triggers involved for those who may be affected by PTSD watching this, I've included some wonderful resources for you to contact if you feel the need. I will also show this at the end of my presentation. For those who will be going to our national conversation, I will discuss the incidents or my lived experience in a lot more detail. But I'll start with my story. I would suggest, like most young police officers, I joined the force to help others. I was 19 years old when I went to the academy to commence 12 weeks of training, and I left the academy 7 foot tall and bulletproof. In the first 6 months, however, one of my fellow academy classmates was the lead car in a police pursuit, lost control of his vehicle and wrapped it around a pole. I arrived at the accident site 30 seconds later and saw him in the car. He died 8 days later. And I went on to self-medicate with alcohol for the next 2 years because unfortunately there was no briefing and nobody spoke about it. Later in my career, I spent 6 years in drug investigation, but I also had an opportunity to train as a police negotiator. Now, there are 2 things I'm very proud of in my police career. Firstly, training to counter-terrorist level as a negotiator. And secondly, I was a team leader for a counter-terrorist team for the Sydney Olympics, 2000 Olympics. Now, during my 10-year career as a police negotiator, I went to over 150 high-risk incidents. Now, some of these high-risk incidents I was called to included hostage situations, suicide intervention, kidnapping, extortion, barricade situations, high-risk search warrants where weapons were involved, and dangerous escapees. But 3 of the worst, which really affected me in terms of post-traumatic stress disorder, were a hostage situation where a woman was being held hostage by her ex-boyfriend. He had 2 knives pressed into her neck for the lengthy part of the 8-hour siege. I will never forget the look of terror on her face and the feeling of helplessness I had that we could only stand back, watch, and try and talk and calm the situation. The second incident was a siege situation where after speaking for nearly 3 hours with a man armed with a carving knife, he ran at me with the knife and got to within 30 centimetres before he was arrested by tactical police. I think you've all heard of fight-flight syndrome. Well, back then, nobody knew anything about freeze, and that's what I did. I froze, and that's why the tactical police had to push me out of the road. The third incident was the kidnapping of an 18-year-old young man by drug dealers. As my role as the primary negotiator, I was giving negotiation strategies to the father. It was a very, very tense situation. The father was listening to the kidnappers bashing his son. So really, really tense situation, and that affected me later on when I had my son. Now, I also had the opportunity to go into homicide investigation. I spent 4 years in homicide. if you think about some of the worst possible murders, these are the crime scenes I was going to. Now, it's not like the crime shows that you see on TV. There's no fake blood or actors. These are real people with families. Women and children horrifically murdered. Whilst this is only touching on my lived experience, I will go into greater detail during my keynote at the Fearless National Conversation. Effectively, after an 18-year career, being exposed to a number of traumatic crime scenes and incidents, I got to the point where one day I could not get out of bed. A friend had to take me to the doctor and I was diagnosed with post-traumatic stress disorder. But more on that later. What is post-traumatic stress disorder? Well, it's a series of reactions that may result from exposure to a traumatic event. Phoenix, Australia, the Centre for Post-Traumatic Mental Health, the University of Melbourne, says that any event that involves experiencing or witnessing actual or threatened death, serious injury, or sexual violence has the potential to be traumatic. And some examples of traumatic events include serious accident, physical or sexual assault or abuse, war, a natural disaster such as a bushfire, flood or cyclone, and a person may feel intense fear, helplessness, or horror. Now, according to Phoenix, Australia, the most common traumatic events in Australia are having someone die close to you unexpectedly, seeing someone badly injured or killed, or unexpectedly seeing a dead body, or being in a life-threatening car accident. Between 5 and 10% of Australians will suffer from PTSD at some point in their lives. So who can be affected? Well, as we said, anyone who experiences or witnesses. This can be Defence Force, first responders, our police, ambulance, firefighters. It can be victims of crime, domestic violence, sexual assault, victims of natural disaster. But please note that not everyone will go ahead and develop symptoms of PTSD. Now, there are 4 main groups of symptoms. I'm going to put these groups up, but I'm going to explain what I was feeling in terms of the symptoms. So the trigger for me was when my first child was born. The horrendous flashbacks of crime scenes of murdered women and children, and intrusive thoughts about my son and daughter being kidnapped or murdered. Intrusive thoughts of my children being stabbed in their beds. My way of dealing with this was to work harder, thus keeping the images at bay. But in essence, I was only avoiding my thoughts and my situation worsened. The important thing to note here is sometimes people who don't have PTSD may wonder why someone cannot let go of a horrific experience. However, PTSD is about having a recurrent contemporary experience. Sufferers constantly relive the experience and thus react as though the horror had just been seen or felt for the first time. I was hypervigilant. I was becoming very forgetful both at work and at home, and my concentration was terrible. For example, I recall driving home from work after an afternoon shift and running a red light, only realising I had done so after another motorist sounded their horn. I was having anxiety and panic attacks. I couldn't breathe properly and it felt like someone was sitting on my chest. I was constantly irritable at work, with my children, my now ex-husband, and with myself. My 5-year-old son summed up my disposition in one sentence. Please, Mummy, don't be angry all the time. That still gets to me. I couldn't handle taking my children to the park as I was exhausted watching them and looking for potential kidnappers or pedophiles. I would become more anxious and irritable. It was just easier to stay at home in my sanctuary. I was also avoiding any news and media reports. Now, at this point, I had been diagnosed with PTSD along with clinical depression, but I didn't really understand why I was acting the way I was, and I refused to accept I was suffering a mental illness. I was fighting it. I was walking around in a zombie-like state, a feeling of detachment from my family and myself. Now, my mental health professional, psychiatrist Dr. Greg Wilkins, had recommended I commence the antidepressant Zoloft. However, as I was fighting the diagnosis of PTSD, I declined to take the antidepressant. Unfortunately, I got to a very dark place before I finally accepted I had a problem. My marriage broke down. I was unable to continue the job I loved, and I came close to taking my own life. It was at this point I finally accepted I had a problem. Now, with acceptance comes the ability to receive the right treatment. You will no longer struggle to understand why you are behaving in a particular way. There will still be good and bad days, but you will have the tools given to you by your mental health professional to help manage your condition. So how can we manage PTSD? Now, I think it is appropriate here to tell you about the current Australian guidelines in terms of PTSD treatment and then give you my lived experience. So I'm going to start with the official Australian guidelines from Phoenix, Australia, and also Black Dog Institute, because they also give a great summary, so I'll add this. So Phoenix, Australia, Centre for Post-Traumatic Mental Health, they have the Australian guidelines for acute stress disorder and post-traumatic stress disorder, which came out in 2007 and were updated in 2013. The guidelines were developed by a team of Australia's leading trauma experts in collaboration with representatives of a number of professional associations. The recommendations were based on best practice evidence found through a systematic review of the Australian and international trauma literature. These guidelines provide recommendations on the best interventions. Please note, the guidelines are intended to guide practice rather than be used prescriptively, as each person's unique circumstances and overall mental health care needs must be considered. The guidelines state, for adults who develop PTSD, the best approach to treatment is trauma-focused cognitive behavioural therapy, or eye movement desensitization reprocessing, EMDR. These psychological treatments involve confronting the memory of the traumatic event and coming to terms with the experience. I'm also adding this: medication should not be used in preference to trauma-focused therapy, but may be considered when a person is not ready or willing to engage in or has no access to trauma-focused therapy. They have additional mental health problems such as depression, which I was diagnosed with, or they have not benefited from trauma-focused therapy. I have added this last note about medication as my concern is that far too often medication is used as a first and only resort. Please note that trauma-focused CBT and EMDR need to be considered first. Now, Black Dog talk about 3 broad categories of treatment for PTSD. Psychological treatment or talking therapies, and they also recommend trauma-focused CBT and eye movement, EMDR. Physical treatments, but trauma-focused CBT and EMDR are first choice. Exercise, mindfulness, and self-help. Often a combination of treatment works best, and this is what I agree totally with. But the main thing I want to tell you before I discuss the tools that worked for me was talk to your GP or your mental health professional about what the best treatment is for you. So what worked for me? Now, this is my toolbox of tools of management strategies. So I want you to think about what tools you can use to manage your own PTSD. Well, the first one and the most important one is talking to somebody. I underwent intense psychotherapy 2 to 3 times a week. Please understand, it took nearly 2 years of therapy before I was engaging properly and not dissociating during exposure therapy. For those mental health professionals watching, in your first few interviews with clients, as your patient, I may well dissociate very early in the session. So you need to find a way to communicate information, for example, psychoeducation, build rapport, create a safe environment, even before you're thinking about EMDR or trauma-focused CBT or medication. You've got to work out how to deepen your rapport with someone who is largely dissociated or disconnected and untrusting. Your first challenge, I very respectfully suggest. I underwent many years of trauma-focused CBT. Nowadays, talking to someone, for me, it could be my partner, a friend. Think about a teacher or a mentor, and a mental health professional if you need to. Not only does it help to process what is happening, it allows that person to help support you. Articulating and verbalizing of a traumatic or distressing incident aids in emotional recovery. It helps in processing the incident. Physical exercise. Physical health and mental health are closely linked. There is much research out there. There's a fabulous paper on the effect of physical activity on PTSD by P.T.S.D and Umberger. And some of their key findings were that physical activity has been shown to reduce symptoms of PTSD in persons with subsyndromal symptoms and persons resistant to standard treatment. That physical activity has been shown to improve health conditions that may accompany PTSD, like anxiety, depression, sleep disturbances, and cardiovascular disease. And that clinicians should include patient-specific exercise prescriptions in their plan of care for treating those with PTSD. For example, walking programs, aerobic activity, or yoga. Now, Dr. Simon Rosenbaum, a senior research fellow at the School of Psychiatry, University of New South Wales and the Black Dog Institute, says including physical activity in the routine care of people who are experiencing PTSD is really important, not only to maximise health benefits, but also achieve physical health benefits and help reduce chronic illness, which people with PTSD are at risk of developing. Physical activity and exercise can play a really important role in the overall treatment of someone who has PTSD. Our research, he says, has shown that when physical activity is added to typical psychological treatment, it can help improve a person's overall recovery, reduce their symptoms, and even deliver benefits such as improved sleep and energy levels and improved physical fitness levels at the same time. Now, people living with PTSD face even more barriers to commencing an exercise program compared to the general population, as often they've been sedentary or disengaged for a long period of time. The key is to tap into what you used to do previously or what you enjoy to help take the first positive step in engaging in an exercise program to help you move forward. For me, I love to go for a surf. I love to go do a gym workout, a walk on the beach or in nature. There is a fabulous book by Florence Williams called The 3-Day Effect, and that talks about the science behind the more exposure humans have to nature, the more they will benefit from it, reduced anxiety. You think about what physical activity works for you, what you actually enjoy, and just start it a small bit every day. The next management tool for me are timeouts. Now, can I just say that I think all children know what a timeout is. So when I say to my children, mum needs a timeout, and a timeout is quite simply 20 minutes in my room, what it does is it allows any irritability to dissipate. I can do my breathing exercises, but my kids know that mummy needs a timeout and it's just that quiet time by myself. Next, yoga. Yoga has strengthening, flexibility and mindfulness. It can help calm that anxious fight or flight response. There's a number of studies that have shown that yoga breathing exercises are beneficial for anxiety and depression. Mindfulness meditation. Now, originally an ancient Buddhist meditation technique, but this has evolved into being aware of the present moment and simply noticing feelings and thoughts as they come and go. There's been 2 decades of research that show mindfulness meditation can help manage stress, reduce anxiety and depressive symptoms, increase resilience and peace of mind to help improve concentration and attention and improve relationships and your overall well-being. The emerging evidence includes that mindfulness meditation might cause neuroplastic changes in the structure and function of brain regions involved in regulation of attention, emotion, and self-awareness. Now, my personal favourite app is the Headspace app. Now, that is the white background with an orange ball. The first 10 sessions are free, And I like the way the mindfulness meditation is explained during the course of these first 10 sessions. You can, of course, sign up after the first 10 sessions or do what I do, and I just keep going back over them for free. I'm probably not sure if I should have said that. Now, my challenge, I'm going to issue the Belinda Neil challenge to all of the people listening at the moment. And I challenge you to do the mindfulness for 1 week. That is 7 days. The application is free. Give it a whirl. No one's making any money from it. And send me an email and let me know if you have noticed a change in your own mental state. belinda.neil@fearless.org.au. If you're up for the Belinda Neil challenge, go for it. Relaxation exercises, including breathing exercises. Now, using slow and controlled breathing to address hyperventilation or shallow breathing. This really helps when I'm feeling anxious. My mental health professional gave me some breathing exercises. If I'm very, very stressed, I might have to do these every hour. Otherwise, I may just do them at night time, but they're fabulous if you've got those breathing exercises. Medication, if required. Now, I fought against my psychiatrist's advice on taking antidepressants, and I ended up in a very dark place. Once I finally accepted I had a problem, I listened to his advice and I took the antidepressants. Fortunately, now I'm medication-free, and I will talk to you about that in a moment. Now, see how I've got a question mark in the box there? I want you to think about what helps you to relax or calm, or if you're affected by any triggers. Another thing I'd like to discuss here is eating healthy, because that looks after both mind and body. And as I said before, physical and mental health are closely linked. One of our wonderful speakers at the National Conversation is Anthony Minichiello. He's a former professional rugby league footballer who captained the Sydney Roosters. After being voted the best rugby league player in the world, Anthony endured 4 years of injury and was told by a specialist that his playing career was over. Now, by accessing cutting-edge nutrition and movement, he returned to play over 300 games and led his club to a premiership. Anthony speaks about this research-based way of eating that is designed to improve energy levels and mental clarity while reducing toxins and inflammatory foods that are the foundation of many health issues. Also, consider cutting back on caffeine, soft drink and cigarettes. Your body's already hyped up. These are only just going to add to it. And be mindful of alcohol. It is a depressant. Now, I'm not your nana. I enjoy a glass of wine. But what I'm telling you or suggesting to you is that when I'm feeling low, I never go for a glass of wine to relax me. The glass of wine is when I'm celebrating or I'm feeling good. If I'm feeling low, I will go for a walk, grab my partner, take him for a walk, and just get outside. Now, I'm going to add here that after 18 months of the antidepressants, I found that whilst they helped in numbing the raw emotions and unpleasant things, it also served to numb me from experiencing enjoyable emotions, such as a hug from my children. Now, my psychiatrist did a study of his patients doing a simple balance exercise twice daily for 5 minutes to activate the cerebellum. Here is a short 1-minute video of this first simple balance procedure. I'm going to show you how to do the first cerebellum exercise. We're going to stand, just standing, preferably no shoes. Doesn't matter if you have shoes, but no high heels. Okay. Set the timer first, okay? Press the timer, 5 minutes. Timer goes, the foot, just raise it slightly, 1 inch above the ground, and just halfway in front of your other foot. Relaxed, the torso is relaxed. Then close your eyes. Now, no doing this, no using your arms. Use your foot, the foot that is at the front, to balance yourself. So if you feel like you're going to unbalance, just use that foot to tap, to balance you. Now, if you are feeling unbalanced, then that's an indication that this exercise should work for you. Now give it a try. 5 minutes twice a day. Okay, after 3 weeks of doing these exercises, I started to feel happy again and was weaned off the antidepressants. Every one of my doctors, my psychiatrists, I should say, patients, reduced their symptoms. His report is an appendix in my book Under Siege. I also conducted a similar study, and everyone who did the exercises twice daily reduced their PTSD symptoms, including the majority of those who were doing them intermittently. My study is available as a PDF on my website at www.belindaneil.com.au. Just go to the PTSD page. I don't believe these exercises should replace current recommended treatments, but used as an adjunct to these treatments.
Belinda, if you can hear me, could you now put your slides back up? Because that video worked wonderfully, but we can't see your slides, and I bet you've got some more great content. There we are, perfect.
Wonderful, excellent. So we did the cerebellum exercises concurrently with the exposure therapy and believe they accelerated the process. I'm now fortunate to be medication-free. Now, some other tools in that question mark are massage. I find that works wonderfully in calming the fight or flight syndrome in my body, the nervous system. It might be listening to music. That might invoke a positive trigger for you. Spending time with loved ones. They are your support base. Animal therapy, PTSD assistance dogs, equine therapy. There are a number of different things. I want you to think about what works for you and know that it is a tool. Now, these are just some of the grounding exercises that I now have in my toolbox, and I choose what I need and when. You think about what works for you. What helps relieve your symptoms, or try some of those that have helped me. PTSD has taken its toll, but it no longer controls me, and I can now manage my condition very well. I often wonder if things would have been different, though, if someone had have spoken to me earlier, or if I had some respite from all the crime scenes I was going to. I have done many years of research, and I firmly believe that early intervention is the key. You can minimise and prevent PTSD. So how can we do this? Well, most of the information in this next section is relevant to all persons who might be affected by PTSD, but I've also added some additional information to those who are first responders, including our police, firefighters, paramedics, etc., as they are attending traumatic situations every day. Please take on board the information that may directly relate to your situation. Now, early intervention is critical in reducing symptoms of PTSD. One of the first things a PTSD-affected person loses is their ability to monitor their own emotional state and track their internalised world. Now, this might explain why I never believed I had a problem. If I had, I could have sought assistance many years earlier, and perhaps my symptoms would not have been so severe. Perhaps I could have taken time out before the next trauma exposure. Now, early intervention being critical, the best person to detect this is a supervisor, friend, or family member. In a joint paper by leading Australian and world experts, Professor Alexander McFarlane, University of Adelaide, and Professor Richard Bryant, University of New South Wales, the paper's entitled Post-Traumatic Stress Disorder in Occupational Setting, Anticipating and Managing the Risk. They state that it can be useful if supervisors can detect signs that may indicate an individual is experiencing some PTSD reactions. The negative impact to trauma can manifest in a variety of indirect ways, which employers should be alert to. But we can all be alert to these signs, and they include increased alcohol and drug use, interpersonal and family conflict, social withdrawal, depression, somatic distress, physical pain and discomfort, and work performance deterioration. Now, these could be signs of a psychological illness rather than a person's behaviour changing as they're having a bad day or a bad week or month. And these don't include the smaller things that can build up. For example, work hours, taking no breaks, taking work home, time pressure, inadequate support from supervisors or co-workers, job insecurity, poor communication, for example. Hopefully supervisors, family members or workmates can pick up on these signs, perhaps look at the jobs that they've been to and see if there might be any correlation and talk to the person. Now, Professor Alexander McFarlane says the more people are exposed to trauma on a regular basis, such as soldiers, police or paramedics, the more their brain changes and the body's stress system becomes more sensitive. The idea is that people get tougher and get used to things and the effects of stress go away, he says. The fascinating thing is that the body actually does keep score. And so next time around, you are so much more vulnerable. For organisations, this is what you can do to help your staff in terms of early intervention. It can involve trauma tracking, supervisors tracking their individual team members' trauma load, supervisors identifying potentially psychologically affected officers, discreet one-on-one conversations between the injured officer and an appropriate supervisor with follow-up and support, removal or respite from frontline duties or from further exposure for a specific period, and referral to mental health professionals. Now, this is either in-house or outsourced psychologists, but they must have expertise in recognising and treating PTSD. The credibility of both supervisors and mental health professionals is paramount. Otherwise, the psychologically affected officer will never declare his concerns. I only recently, last week, learned that Phoenix Australia actually run 2-day courses to give mental health professionals expertise in trauma-focused therapies. I think that's a wonderful initiative. 2-day course with follow-up. Fabulous. Now, I'm reminded of a quote from retired General Peter Cosgrove when he admitted his former scepticism about psychological health programs back in 2013. I have changed my mind because what the evidence shows is the earlier the intervention and support given to any soldier diagnosed with a psychological problem, the better the chance they have to minimise its effects. The key is the availability of and access to experts in post-traumatic stress. This is something we at Fearless are working towards. A national management protocol must include mental health professionals who have expertise in treating PTSD. For those who are attending our national conversation, we will be workshopping the national management protocol on day 3 of our national conversation in August this year, and would love for you to be involved in this. Also, for those affected by PTSD, don't be afraid to say to your mental health professional, what trauma-focused therapy will you be helping me with? I think it's a fabulous question to ask. So what can you do as a family member, a workmate, or a supervisor? Now, we need to be very mindful here that everyone is different. Someone may be affected by just one exposure to a traumatic incident, but it may take a number of incidents before someone else is affected, and others may not be affected at all. You do not need to have experienced PTSD to understand what it is. Educate yourself about PTSD, and today's webinar is part of that education. Keep an eye on your workmates, your friends and your loved one for any signs or symptoms that there might be an issue. Let them know you support them. Lack of support was such a big factor for me. I felt so alone and isolated, and this added to my decline. Ask the person if they're okay and listen to them without judgment. Show them you care. Do something nice with them. Go for a coffee or a walk. Pick up the phone. Send a text. Encourage them to seek professional help via their GP or a mental health professional. And always look after yourself. But I'd like you to remember this. People with PTSD can often seem disinterested or distant, and you may feel shut out. This is usually because the person is trying not to think or feel in order to block out painful memories. They may stop participating in family life, ignore your offers of help, or become irritable. They may not feel there is an issue. It is important to remember that these behaviours are part of the person's PTSD. They are not about you. They probably need your support, but they just don't know what they need or how to ask for help. Now, while there is much research to support early intervention, let's consider the situation of the psychologically injured person who is suffering the symptoms of PTSD, who has seen horror or been continually exposed to trauma. I have been there, as have close friends of mine. So the best advice I can offer fellow sufferers is this. Psychoeducation is critical. Gather knowledge about your condition, whether it is PTSD, anxiety, depression, or some other ailment. Educate yourself on the symptoms of PTSD. My research helped me to gain insight into my condition and into why I was acting in a particular way. It served to make me feel less alienated and gave me focus on how I could help myself. And don't be afraid to ask for help or talk to someone if you're not sure. Consider all the classic symptoms that I have mentioned, and if you have any of these, seek help. Speak to your GP or a mental health professional, for example, a psychologist, psychiatrist, ensuring your mental health has expertise in the area of PTSD. Getting help is not a sign of weakness, and it is best to get help early. Speak to others who've been in a similar position. They understand. And of course, accept you have a problem. With acceptance comes the ability to receive the right treatment. You'll no longer struggle to understand why you're behaving in an unusual way. And you'll have the tools to help manage your condition, even though there will be good and bad days. Let your family and friends in. They will help you. They are your support base. You need support. And once you accept this, you will better manage your condition. I love this quote. You can't stop the waves, but you can learn to surf, probably because I enjoy surfing. Waves might knock you down occasionally, but these skills will stop you from drowning. I still live with PTSD, but I have learned to recognise what triggers an escalation in my symptoms. This allows me to better manage myself and use the various techniques I have learned. I have a wonderful life now because I've learned to manage my PTSD. It does not control me. Now, we've discussed management tools and early intervention, and effective treatments are available and you can get better. I'm going to provide you with some resources. Take these to your GP and always ensure your mental health professional has expertise in PTSD. I know I'm repeating myself, but if it's the one thing that you go away with, that has made me very happy. At Fearless, we've got a page devoted to resources. This is our Fearless website. This is our Fearless page. The Getting Help, Need Help Now, and Useful Links. We've got a number of great links on there. I had up the Phoenix Australia link before, the Black Dog, but jump on there, have a look at the links, go to the various websites, educate yourself on PTSD. And lastly, I'm very pleased to be able to tell you about our national conversation to be held over 3 days from the 21st to the 23rd of August on the Sunshine Coast. Now, the themes for the conversation are the lived experience, and I'm honoured to be delivering a keynote. There'll also be a panel of others who will talk about the lived with experience and what treatments help them on their road to recovery. Families. We at Fearless believe families are so important. If 1 million in Australia are affected with PTSD, there are 3 million family members affected. We have a panel of family members to discuss this, and it's the first time this has been done that I'm aware of in Australia or overseas. Living with hope is another theme. There will be medical research and holistic strategies to help those affected. And also, as I said before, we'll be workshopping our national management protocol. PTSD is a significant problem and it requires a national response. Now, in addition to those speakers mentioned by Admiral Chris Barry in his webinar, I can also confirm, not only as a speaker, but I'm very proud to announce our newest ambassador, Natasha Exelby, as our Fearless ambassador. She's an award-winning journalist with 15 years of experience working in some of the world's top newsrooms. She's worked as a war correspondent in Afghanistan and Syria, foreign correspondent, reported from more than 20 countries, including Europe, Asia, and the Middle East. Natasha has seen some horrendous things and been exposed to some awful situations. The first time Natasha opened up about her PTSD was during the reality TV show, I'm a Celebrity, Get Me Out of Here. To me, that is incredibly brave. She's a very brave and strong woman, and we're very excited to have her as an ambassador, but also speaking at the national conversation. And some other of our speakers, and this is the beautiful Sunshine Coast, so come up for a holiday, enjoy the holiday as well as our conversation. Professor David Forbes, he's a clinical psychologist, and director of Phoenix Australia. Professor Richard Bryant, he's the director of the Traumatic Stress Clinic and a professor of psychology at the University of New South Wales. Patria King, She's the CEO of the Quest for Life Foundation. She is an amazing woman, and the Quest for Life Foundation actually run a 5-day residential program called Moving Beyond Trauma and a 1-day program on living mindfully with post-traumatic trauma symptoms. We'll have Esther McKay, a former police officer, medically retired with PTSD and author of Crime Scene. She's the founder of the Police Post-Trauma Support Groups in New South Wales and currently involved with New South Wales Police Legacy Backup for Life. If you're a first responder organisation coming to the national conversation, you really need to touch base with this amazing woman. And of course, Anthony Minicello, who I spoke about earlier. If you want to know more about PTSD, if you are affected by PTSD in any way, whether as someone who suffers PTSD, a family member, supervisor, mental health professional, GP, insurance companies who deal with persons affected, or you have ideas or solutions for preventing, identifying and managing PTSD, join us and start the conversation at our national conference in August. I'm really pleased to say that our early bird tickets have been extended until the 24th of May. So jump in. I think there's a few prizes up there. And the other exciting piece of news that I would like to announce now is that we are going to be calling for abstracts for poster presentations at the national conversation. So if you have an idea backed up by research and is evidence-based, we would love to hear from you. Keep an eye out on our social media as this will be launched on the 20th of May. So there's where we are. You can locate us on our social media site. Now, I'm going to hand you back to Yvette. This has taken a little bit longer. Sorry for our little program problem earlier. I'm going to hand you back to Yvette because we're going to look at questions now.
Thank you, Belinda. You did very well coming back and keeping your composure because that was a bit of a blip, but we tried all our different things and we got there in the end. And fantastic presentation. I've obviously been dealing with you, but haven't had the pleasure of knowing your story. And I think for me, it really resonates that, you know, you can watch television shows or talk to police or think you know what they experience, but you really don't unless you've lived it probably. And you really, I think, paint a pretty crazy picture of what it was like for you. And I think you too are very brave and amazing for doing what you do on a volunteer basis for Fearless too. It's worth mentioning all the people involved in Fearless are volunteers. So they really are doing an amazing project by putting on something like the conference. I think it's great that you put the tickets up too and mentioned the early bird being extended, which we would encourage everybody to look at. And just note that the community one is by application and there's a set allocation of those. So that's at the most affordable rate of all. And I believe, can you clarify this for me, Belinda? How do you qualify as a community person that would be eligible for a ticket like that if there's any sort of lack of clarity around that?
I think there's actually a format that people can fill out and they just need to send it to us and we'll make that judgment in relation to whether they can get those community rates. And it will be very bound by their current circumstances and financial means as well.
Yeah, absolutely. But just good to make sure people are aware of that because I think that we want to make sure they know that they're catered to as well. Well, there's been a huge amount of interaction, which says to me that people have loved your presentation. And I'm going to start with the questions. So I'll pull those up for you and read them out one by one. So this actually came in prior to the presentation being started. This person says, it's always there, avoidance. It must be dealt with. Avoidance is a universal problem in PTSD and often severe. This extends to avoiding appointments with treating practitioners. This makes PTSD a self-defeating disease. And the more severe the PTSD, the more severe the avoidance. What strategies are helpful to reduce avoidance and improve engagement? Any tips there? That was asked by, I hope he doesn't mind me sharing, Dr. Ben Bowser.
Yeah, look, that's a really good question. You've got to remember, you've got to deal with PTSD holistically. And I wish to qualify again, I am not a mental health expert. So I've put all those symptoms, there's 4 groupings of symptoms. And for me, I guess that what I can tell you is when I dealt with my psychiatrist, there were times where I nearly walked away and that was due to avoidance. So the relationship between the mental health professional and the patient is so important. Don't try and fix us in 1 or 2 sessions. And please, I'm just giving you my perspective as a patient. What's more important is building up that rapport. And that became very, very important, especially when I had suicidal thoughts. So if you can build up the rapport, my psychiatrist became my lifeline. And because at the time I didn't have a massive support work around me. I didn't want to. I thought I would affect my friends and family. Therefore, I didn't talk to them about what was really going on. So there's 2 points in relation to that. As someone affected by PTSD, please let your family in, because they're one of your best support bases. But deal with it holistically. And for mental health professionals, please look at that. Building that rapport is so important. You are our lifeline. That's what you will become. Lastly, in relation to that, what I would say is, if you are not happy with your mental health professional, find somebody else. You're the most important person and you need to get help. And that's why I've said it so many times during this presentation. Ask the mental health professional, what trauma-focused therapies will you be using? That's really, really important.
Yeah. Now, there's quite a few, so I think we should go also in the interest of time. Ben's asked another one, and I might come back to that, but I think we should just make sure we get as many people a chance as possible. Is that okay with you?
Yeah, can I just jump in for a moment, Yvette, because I'm noticing a lot of conversation to the right. I'm not sure how I can go up and down, but someone is talking about yoga. And the first yoga course I ever did, I found really, really difficult because there was more of a meditation, and I wasn't at that place yet. But Andrew Adams has brought up frontline yoga, and I have actually done the training. I have sat in on the training for frontline yoga, and they are very specific for first responders. They are wonderful. So they actually cater to first responders in yoga. So that could be something for people to take note of.
I think that's really wonderful, because anyone suffering PTSD or mental health issues or other issues do have special needs when it comes to any kind of fitness activity or other activities. So it's great that there's that initiative out there. Here's a question from Mike Doroshenko. Recently, the Victorian Police Chief, Graham Ashton, and Association President GAT said their longer-term goal is to push for all police veterans to get the sort of extensive benefits former Defence Force personnel have had for decades. What steps are Fearless taking to address the lack of government support for police veterans?
That's a brilliant question, actually, Yvette, because it really comes back to why we are having the national conversation, why it is so important for people to be involved, the different first responder organisations, to get a national management protocol. When you come together as one voice, you carry so much more weight than 3,500 different agencies trying to do different things. We need to come together. Workshopping that national management protocol is going to be so important.
Yeah, absolutely. And that seems like an obvious one, but of course the conversation will dictate where that goes.
That's right. Yeah.
Here's another question. Media portrayal of PTSD is incorrect, unhelpful, and sometimes stigmatizing. PTSD people are generally nicer, more considerate, more understanding, and more compassionate than the average person. Perhaps this is partly why they got PTSD in the first place, and partly reflects that people who suffer learn from the experience. They're normal people deserving respect and compassion. In contrast, media portrayals are very unhelpful, often depicting unhinged US war veterans doing bizarre acts. What do you think about media portrayal? You do a lot of media work.
Yeah, look, I'm not sure I entirely agree with Dr. Balzier's statement. I think beforehand there have been some really unhelpful portrayals for sure in that sense. But I think nowadays the actual media portrayals, people are finding out, they're being educated through media in relation to PTSD. I think via social media, I think movies, I think through various TV shows where PTSD is portrayed. So people are starting to understand PTSD a little bit more and be a little bit more compassionate in terms of those with PTSD. And this all helps with destigmatizing PTSD. The other thing is, it was something someone once said to me, is we get PTSD because we care. And I think that's amazing. I think, Dr. Balzier has hit the nail on the head. You know, you are compassionate, you are understanding. Therefore, perhaps it does really, you know, hit you a lot harder than traumatic exposures for other people. Again, I'm not an expert in relation to that field. I can only comment on what I have seen and the people I've seen in terms of PTSD.
Sure. Now, I am aware we're over time, but we did obviously just lose a little bit of the time at the start. So I'm just going to do a little bit of a canvas through the list. And there is a lot of conversation and chatter, and just see if there's anything else here. I don't know if they're actually talking to you or talking to each other, because there's so much chat going on. But there's a really great thing. We wanted to start a conversation. That's exactly what's happening. Donna, sorry?
A key message, Yvette, that I would like to get across to everybody listening is that you can learn to manage your symptoms. I have come from a very dark place. I now have a wonderful life. I wouldn't say that I'm cured, but I can identify my triggers because I've done a lot of research and educated myself. You can get better. There are management tools for you to use. So educate yourself. Think about the tools that I've given you today. Think about what helps you and incorporate those into your toolbox. My heart goes out to all those who have PTSD. I've been there. I know what it's like.
I think it's a question from Donna to you, but as I said, it could have been directed while they chatted amongst one another. She said, do you use P.T.S.D. King's meditation CDs? Oh, no, that was to Debbie. I need to have guided meditation or mindfulness. Have you got any tips on good CDs, people to look out for on YouTube or anywhere else?
Look, the Headspace app is fabulous. That's a fabulous mindfulness meditation. And you've got, you know, you've been given the Belinda Neil challenge. Everybody, you're more than happy to contact me, but do it for 1 week. You've got 10 free sessions. Have a go. P.T.S.D. King and Quest for Life have some wonderful meditation CDs as well. So jump onto their website and have a look. I do want to answer to somebody who has made a message, because she's entirely right. I made the comment, we get PTSD because we care. And that is what was said to me at one point. But just because you don't get PTSD, and Kim, I'm talking to you, it doesn't mean you don't care at all. Can I just say that one of my favourite mentors in the New South Wales Police, he has about 20 or 25 years of experience in homicide, going to some of the worst crime scenes you can imagine. He doesn't have PTSD. That doesn't mean he cares. He's amazing. So I get what you're saying, Kim. It's very right to pick me up on it.
Yes. Now, there's other comments and things. I might just pick up on them. Someone said it's hard to find a good psychologist. Have you got any tips on finding a good one?
Look, that's
pretty personal, isn't it?
It is personal, but the tips are you need to make sure they have expertise in PTSD. So when you speak to the GP, because a GP, depending on whether it's a work cover issue, a hurt on duty, or whether you're going to be going on a mental health plan, your GP is the person you want to talk to in relation to that. Now, they might have information or recommendations. Otherwise, talk to those of us with lived experience. If you know somebody who is seen, we're happy to talk about and we're happy to recommend the people for us, but that doesn't necessarily mean that person's going to work for you. So it is a matter of trying to find the right person. That is very difficult, yes. But not unheard of. You can find there's some really wonderful mental health professionals out there.
Look, guys, I'd like to just extend really before we wrap up, and conscious that some of you may be on lunch hours and need to get back into it. If you'd like to ask any more questions, drop us a line, or there's an ask a question little tab there. You're welcome to go on as well. And of course, you can always interact with everybody through the social media channels. So we're planning one more webinar. It'll be in the month of June, probably mid-June. We'll get dates out about that pretty soon. Make sure you're joined to the Fearless database, and that you are the first to hear when the next webinar's on, any other opportunities that you might be able to get involved in, and updates on the conference as well, of course, new speakers, program updates and so on, because Belinda's sharing what's happening, but as you've seen, there's still calls out for abstracts and things. There'll be more exciting updates as well. So I think a few of you did indicate you heard about it on social, but if you haven't connected and you are on social media, connect to Fearless on those channels, and we'll keep you posted. But doesn't look like any more further questions coming through.
Oh, well, one thing, because I'm very big on the fact that you need to speak to your GP or go to a mental health professional for help, Phoenix Australia actually have guidelines for practitioners. So perhaps you can download those, give them to your GP, give them to your mental health practitioner. I'm trying to educate you, but you can always take these to your GP and say, look, here's some information in relation to how to treat patients with PTSD. So that's another option. But there is treatment out there.
Yeah. Absolutely. All right, guys. Well, overall, we're getting just lots of thanks through. Thank you for everyone for organising this, first time attending, very informative. There will be another presentation totally for free again, as I said, in June. We'll be announcing all the details soon. We hope you can join us for that. If there's anyone who wasn't on this presentation that you think, oh, gee, they should have seen it, they would have really benefited from that, don't worry, we're going to forward you the recording, and you're very welcome to forward that on to whoever you like. With these sorts of things, we're very free and easy with the sharing of the information. It is about helping people and making sure they're aware of what support is there and what's happening in this space. So thank you, Belinda, for such a great presentation and being so candid and open about your experiences with PTSD.
Thank you so much, Yvette, and thank you so much for everybody to take the time out and listen and educate yourselves in relation to PTSD.
Wonderful. A good afternoon to you all, and let's stay in touch.
Thank you.
Bye-bye.